Good evening, everyone. Over the next few minutes, I would like to talk to you about how to write reviewer comments. And I extend my special thanks to Dr. Arvind, who has helped me in making this presentation. Now, a well-framed reviewer comment helps in decision-making of the manuscript. It helps the editor or the journal to take a decision on whether to accept the manuscript or to reject the manuscript. When these manuscripts are either poorly organized or too brief, they have very little importance in this decision-making process. Especially inaccurate or inadequate comments, they may sometimes lead to wrong early acceptance of a manuscript, which otherwise had a further scope for improvement, which is then lost. Ultimately, what gets affected is the quality of the publication. Every effort is to be made for putting in a well-organized review in a manner that contributes towards evidence-based medicine. Now, how to organize these comments? First and foremost thing is to read the entire manuscript in its complete entirety. You should read it again for better understanding. And based on that, a recommendation should be reached, like accepting or rejecting based on the journal specific options. And all this should be reflected in the summary that supports the recommendation that the reviewer has written. It should cover the major concerns that are there with the manuscript, the minor concerns, if at all, in the manuscript. But no matter what you do, all these comments, all the review should always be constructive. Now, reading the manuscript. You should first of all only accept the invitation to review a manuscript which falls under your area of expertise. Otherwise, you will not be able to justify reviewing this manuscript. Thoroughly read the manuscript, as this will give you an idea of what the research is all about. And then repeat reading, mark all the issues that are presented in this form of the manuscript, and do a line numbering based comment system when you are doing this, when you are doing repeat reading, as this will help you in later part of the process when you're writing your major and the minor concerns. Now, coming to the appropriateness of manuscript, one needs to see whether the manuscript is relevant to the journal or relevant to the literature, and if at all it has this content, whether the same is impactful or not, whether there is clarity on the methodology as well as the manuscript in terms of its results and the details that it gives, whether it gives you any new information, or if there is any novelty in the thought that the manuscript tries to cover up. Look at all the sections like introduction, methodology, results, and discussion, and see whether all of these are centered over the research question or the hypothesis or not. Reporting guidelines such as PRISMA, STROBE, whether they are followed or not, depending on the type of the research question. Look at the strength and limitation, whether they are discussed in your review or not. See the relevant references, whether they are cited in this manuscript, because many manuscripts may be written much earlier and they may be sent to you at a later date, and it may miss the recent evidence on that topic. Look at the tables and figures, whether they're clear, relevant, and correct, and whether the data matches to what it is written in the main part of the manuscript. And basic formatting and organization skills of the manuscript should be as per the instructions to the authors for that particular journal. Now, example of a poorly written review is great paper cannot be accepted, can be accepted. Great paper recommend acceptance. This paper does not add anything new to literature, should be rejected. This paper is not appropriate for the journal. There are several flaws in methodology. Now, these are not of much relevance when it comes to a decision-making process, because they are just statements and they are not backed by any reasoning. We need to give a reason why the manuscript is good or it is bad, or if there is any flaw with the manuscript or any concern. That needs to be detailed. While writing the summary of review, you should write it in your own words. What is the summary of the manuscript that it claims to report? By this way, it will show the editor how, as a reviewer, you have interpreted the manuscript, and this will highlight any major difference in the perspective that you see, and whether that is different between you and the other reviewers or the editor person. It will give you an overview of the manuscript's strength and weaknesses. Think of this about your own take-home message of the review, and end this section with your recommended action, that is as per the journal's instructions. Now, the major issues. These are essential points that need addressing before any further progress can be made. These are issues which are strict for compliance to the journal guidelines that are stated in instructions for authors, and whether these are issues that are related to the research question proposed in the study. If there is anything wrong there, then this is a major issue. Example, if the rationale of the study has not been adequately described in introduction, and whether the authors have shown how, if they've forgotten to show how the sample size for the study was calculated. Avoid recommending any additional work that can be the next step in the study. Like it is sometimes seen that reviewers say that if this another group was formed in a prospective or a randomized control study, it would have been a much better study. Since these issues cannot be addressed and cannot be formed, hence, as a reviewer, you should avoid making such comments. Coming to the minor issues, they are minor, but they are still very important. These are unrelated issues concerned to the research question. They don't affect the overall conclusion of the manuscript. These may be small grammatical errors, unless they are so big that it becomes difficult to comprehend the manuscript, which then becomes a major issue. It may involve missing inadequate or incorrect references, which can sometimes be a major issue if it is lacking at a major front. Technical clarification like the value of p-value significant or not, whether the significant decimal points are used in a similar manner throughout the manuscript, these are minor issues. And the presentation of results that need to be in a data form when they're crowded rather than in a tabulated form, these are minor issues that can easily be corrected by the authors. Now, confidential comments to the editors: disclose any potentially competing interests here, because then you are biased in the manuscript. Specify whether you as a reviewer, you're willing to look at the revised version of the manuscript. If you're reviewing for a journal which does not give you option for writing confidential comments to the editor, then write to the journal office directly. And in this section, you can specify any information that questions the validity of the study. If you have any questions about the data manipulation, plagiarism, and if you need any additional information which may not be appropriate for putting in comments directly to the authors of the section. Now, additional points that can be added is recommendation on concrete evidence and specific examples, but one needs to be very specific so that authors can understand how to improve their manuscript. In doing this, one should be very thorough, professional, respectful, but neutral, which is the key here. Remember to include all the good aspects of the study in summary, even if you are not accepting the manuscript for the journal. Don't use the review to promote your own research, because self-citation and promoting your own research through this channel is not the right method. Don't reject the manuscript if it needs significant editing and writing quality. Just mention it in comments so that can be taken care in the manner editing. So to take home, the review comment should be presented in an organized manner. The recommendation should always be made after thoroughly reading and rereading the manuscript based upon the major and minor issues. Rejection should not be based upon minor issues, especially the editing or grammar. Short reviews should always be avoided as they are not useful or helpful to the editor. And the aim should always be constructive so that the authors can improve the manuscript even if it needs to be rejected. Thank you for your patience.